All right, if you're in nursing school, you know that mastering clinical skills is just, well, it's everything. Today, we're going to zero in on one of those fundamental procedures, intradermal medication administration. Let's really break it down step by step so you can walk onto that floor feeling confident. So, why are we focusing so hard on this one type of injection? Well, look at this number. Administering medication isn't just a small part of the job. It can be up to 40% of your entire workload. Seriously. So, getting this right isn't about passing a skills check, it's about patient safety every single day. So, what exactly is an intradermal injection, or ID as you'll hear it called? It's pretty simple, really. We're injecting a very small amount of medication right into the dermis. That's the layer of skin just below the surface. And you're going to see it used all the time for two main things: TB screening and allergy testing.
Okay, before you even think about picking up a syringe, we have to talk about safety. This first part is all about those critical checks that happen long before you even get to the patient's bedside. This is your first, and honestly, your most important line of defense. Every single thing we do in nursing starts with this principle: first, do no harm. So, before you approach a patient, you have to ask yourself, am I truly ready? Have I done all the prep work to guarantee this person's safety? Let's dig into what that readiness actually looks like. Your prep work starts in the client's chart. Before you gather a single piece of equipment, you have to review their medical record and the medication administration record, the MAR. You're hunting for known allergies, double-checking that the provider's prescription is correct, and, this is a big one, you're looking up your own facility's specific policies for this skill. Never assume it's done the same way everywhere. And this slide, this is the absolute foundation of safe practice: the rights of medication administration. Honestly, just think of this as your non-negotiable safety checklist. Right client, right medication, right dose, right route, right time, and right documentation. You're going to check these again and again until they become second nature. Okay, chart review's done, you've got your rights in mind. Now it's time to gather your supplies. You'll need some non-sterile gloves, the MAR to check against, the medication itself, a very specific 1 milliliter tuberculin syringe with a tiny needle, a skin cleanser like an alcohol swab, and some sterile gauze. Having it all ready to go just makes the whole thing smooth and professional. All right, so we're moving from preparation to action. We are now at the patient's bedside. This is where your book knowledge, your technical skills, and your people skills all come together to create a safe and, hopefully, comfortable experience. The second you walk into that room, the procedure has started. Pull the curtain for privacy. Introduce yourself. Wash your hands. Then, and this is absolutely critical, identify your client using at least 2 identifiers, like their name and date of birth. Finally, tell them what you're doing and why. This isn't just a list of tasks. It's how you build trust. Okay, so you've built that rapport, you've confirmed you have the right patient. Now comes the moment of execution. Intradermal injections are all about precision. The target area is so small, so your technique really has to be on point. So, where do you actually give the injection? Well, that depends. For a TB test, the standard spot is the inner forearm. Why? Because it's easy to get to and, more importantly, easy to check later. For allergy testing, you might use the upper chest or back, mainly because there's just more room for multiple tests if you need it. I want you to pay very close attention to this number. This is your angle of insertion, 5 to 15 degrees. That is almost flat against the skin. It's an incredibly shallow angle, and it's the key to making sure that medication goes into the dermis, not into the subcutaneous tissue just underneath it. 2 more critical instructions for you right here. First, the bevel of the needle. That's the little slanted opening at the tip. It has to be facing up. This helps the needle slide right into that top layer of skin. Second, you only insert the needle about 1/8 of an inch. That's it. You should be able to see the tip of the needle right under the skin. So how do you know you did it right? How do you get that instant feedback? You're looking for the bleb. As you slowly inject the medication, this little wheel or bubble is going to form right at the injection site. Seeing that bleb is your visual confirmation that the medication is exactly where it needs to be. If you don't see it, something's off. Once that bleb forms, you just withdraw the needle at that same shallow angle. You can gently blot the site with gauze if you need to, and I cannot stress this enough, never, ever rub or massage it. That could mess with the results. Immediately click on the needle's safety feature and drop the whole thing straight into a sharps container. No exceptions ever. Great, the injection is done and the needle is safely disposed of. But guess what? You're not finished yet. This final phase is just as important. It's all about what happens next, the follow-up, the evaluation, and of course, the documentation.
And look at how different the follow-up times are. For an allergy test, you're looking for a reaction in just about 15 minutes. But for a TB skin test, the patient has to come back in 48 to 72 hours for a proper reading. This is critical info you have to communicate clearly to your patient before they leave.
And here we are, full circle, back to the rights. Documentation is that final right, and it's not optional. You have to accurately record the date, time, medication, dose, route, and the exact location of the injection. Also chart the client's response and any education you gave them. Remember the golden rule of nursing. If it wasn't documented, it didn't happen. You know, in a perfect world, every procedure would go exactly by the book. But we work in the real world, so what do you do when things don't go perfectly? Let's talk about how to manage some of those unexpected outcomes.
Our source material is really blunt about this. An accidental needle stick can happen. This is a real risk. So the goal isn't to pretend it won't happen. The goal is to know exactly what to do if it does. If a needle stick happens to you, the very first thing you do is take a breath and stay calm. Don't panic. Then, immediately, you follow your facility's specific policy for exposure. This is not something you guess at. You need to know the protocol beforehand. It's there to protect you and your health.
Here are a few other potential curveballs. With allergy tests, a severe anaphylactic reaction is always a possibility, so you make sure emergency meds are available. A positive TB test, which means a hardened bump of 10 millimeters or more, means you need to notify the provider right away. And what if no blood forms? You probably went too deep. Just document it and follow your facility's policy. You know, mastering a technical skill like an ID injection isn't just about checking a box off a list. Your competence, your ability to perform this safely and correctly every time, is the absolute foundation that all compassionate, effective nursing care is built on. So we'll leave you with this question. You now have the steps, the reasons why, and the safety checks. You have the technical skill. But a procedure is so much more than just mechanics. How are you going to use your communication, your presence, your competence to turn this simple technical skill into a genuine act of care? That, right there, is the art of nursing.